I was introducing Saugato. I said he studied in Delhi University, and then he has his PhD from MIT. And he worked with The Economist, as in the magazine, and the World Bank before he was with ideas42. Saugato and his team have also been working with eGov over much of the past year. We've been looking at the question of what makes ULB employees more responsive to the kinds of requests or services that they receive. And I'm also going to ask him to talk about that towards the end of the presentation. But with that, let me hand over to Saugato. Also to say it is, what, 8 a.m. for you? And we're very grateful you're joining us this early in the day.
Thank you, Ameya, and not at all. If I think working with partners all over the world means that time zones are sort of fairly notional most of the time. So thanks everyone, and thank you, Ameya, Neetu, and others for this opportunity to talk about the work that we do, including, of course, the work that we all do together. So today I'll be talking about using behavioral science in urban governance and service delivery, so addressing issues in the urban space. But I wanted to start, if this would kindly advance, which it isn't at the moment. Give me one sec. Knew there had to be some technical issue, no? Okay, it's moved, wonderful. So I'm gonna start by introducing us to ideas42 and talking about our approach to behavior change. And then I'll sort of zero in on some of the work that we have done and that we have been doing around these issues of service delivery, etc., in an urban context. So what is ideas42? Ameya already talked about this a bit, but basically we're people from a variety of backgrounds, but interested in using the sciences of human behavior, the intersection of economics, psychology, design, to do work that has social impact. So to work with partners to improve outcomes, to generate success in the kinds of programs that people are working on. And we work in a lot of different countries. This map is always changing. I don't even know if this is the latest version, but basically these are all the places where we've had projects, and we've worked with partners in more than 40 countries. And we work on a lot of different issue areas. In the international space, most of the work, although international development is sort of its own little bullet point here, but some of the economic mobility work, some of the financial health work, the governance work, climate change work, and beginnings of education and health as well are areas that we work on. And these are some of the funders, partners, and so on that we have worked with. And I don't know what's happening with my computer because this is not advancing again. So give me a second. Okay, maybe I have to use this on-screen thing. That might be better. So very briefly about when I said we use the science of human behavior, what do we mean here? Really, we're thinking about how people make decisions and actions in the real world. So this is obviously drawing on a lot of theory coming from different places, but it tells us certain interesting regularities about the way human beings make decisions, and then when and how and if they follow through on these decisions by taking actions. But it also then gives us ideas about tools to actually influence behavior. So low-cost behavioral interventions. You must have all heard this term nudge. So something which is sort of something small, something that might not initially seem like it actually has a lot of potential, but we found repeatedly in a lot of contexts that these things do actually make a difference. And so we build on the fact that everything that's going on in the policy space involves a lot of people making a lot of decisions in a lot of different contexts. And what we'll see is that the context becomes a very important determinant of thinking about how these decisions actually happen. And so here is sort of the sort of core idea behind behavioral science, which is that what we have on the screen is what we might call the standard model of behavior. So as Ameya said, I was indeed trained as an economist, and as an economist, you sort of start with this basic idea that there are benefits and costs to anything. And and you think about decision making as essentially doing a cost benefit analysis, saying, if I do X, does it actually benefit me more than it costs me to do it? And obviously, costs could be a variety of things. They could be actual monetary costs, they could also be time, they could be effort, they could be a variety of other things. And the idea at its core is, if the benefits exceed the cost, then it makes sense for me or for whoever to do this thing. And once I've decided to do it, I do it. Action follows naturally from decision. Now, what we think as behavioral economists, as behavioral scientists, and this really draws on a lot of years of research, is that actually things are much more complicated. And it's not that decisions are simply based on a cost benefit analysis, nor is it that decisions necessarily lead linearly to outcomes through actions. There are a number of other factors that might get in the way. So here are some things that a traditional economist simply wouldn't think about. Was I already good today? Why should this matter for the thing that I'm going to do now? But now think about your decision. I don't know how much this will resonate, but I think it'll resonate with some of you. It certainly resonates with me. Think about the decision about whether or not to have something, tasty and sweet. And that decision might be based in part for some people, not just on whether will I enjoy this more than it sort of cost me, perhaps in terms of potential impact on my health, but on whether I've, let's say, exercised in the morning. So if I've done something good already, I might feel like, I have license to actually enjoy myself a bit. And so that's very hard to encompass within a traditional economic model. That's really the kind of thing that behavioral economics thinks about. It thinks about what else is happening around you, what else has happened, what are you seeing go on, what are some of these other factors in your context, in your environment, that influence what you actually do? And so here are some more. And so what this leads to are sort of a couple of buckets in which we can think about problems that arise in decision making. So one is the idea of intention action gaps. I already touched upon this. People don't always follow through. Right? You might decide to do something, and then you might never get around to doing it. You might postpone it. You might put it off. You might, not decide to do it in principle, but never actually figure out when and how you're going to do it. It also leads to suboptimal decision making through various kinds of biases. So the decision itself may be driven by a number of things that are really kind of extraneous to the true costs and benefits. So for instance, in what order was I given various options might influence which of them I choose in a way that has nothing to do with the merits or demerits of the specific actions. And so here are some key simple takeaways from behavioral science that, we're complicated, people are complicated, but there is a method to this madness. It's not like people are arbitrarily taking decisions all over the place. It's just that these are systematic and they're predictable, but they're not the things, or the influences are not just the things that economists might consider, not just things like prices and availability or awareness or information. There are a lot more things going on. And then from that, obviously, then once you've identified what these other factors are, you might be able to find ways to affect things and apply interventions to outcomes. So what does this have to do with the topic we're talking about today? Well, I talked about, billions of people making trillions of decisions, right? So all of these decisions also apply in a governance context, in thinking about people going about their lives. So anything you think about, for instance, think of many of the things that government, and we're thinking now urban governments, are set up to do. There are a lot of decisions and actions. They range from things that citizens do or do not do. So, how do they use resources? What kind of transportation decisions do they make? What do they do with their waste? These are just some examples, but also to the way government officials actually make decisions and take actions, right? So Ameya talked about our work together on trying to address responsiveness to citizen submitted complaints or requests. Well, we'll talk about that towards the end in the specifics, but that's an example where, there's something that a citizen is doing, and then there's something that a government official is or isn't doing in response, which affects the outcome, which affects what happens. So these are just some examples. And again, behavioral science can therefore help us understand some aspects of these challenges and devise low-cost solutions that are hopefully scalable, that can be implemented, that can be tested, and we can see whether they actually help or not. So I'm going to go through a few cases of work that we've done already related to these kinds of issues. So the first one has to do with the use of water. And I think most of you, I assume, are in Bangalore, so you don't need an introduction to the fact that water scarcity in urban settings is a thing. I think actually basically nobody in India needs an introduction to this fact. It's a thing in many parts of the world, and it may not be as severe as, say, Cape Town or Chennai, when there were sort of issues some years back with literally there being no water. But even when we worked with some colleagues of the World Bank and with the city of Belén in Costa Rica, this was a problem. Water was beginning to run out. Specifically, this town used a lot more water even than the average, so there was a lot of water being used, and it was in danger of running out of water pretty soon if consumption patterns didn't change. Now, what we found when we went through, when we did the field work on this problem, was that while a lot of this had to do with individuals' user and water use, now you could imagine situations where water use is primarily driven not by, let's say, just regular water consumption. Maybe it's driven by industrial consumption, or it's driven by, something that's happening within government. In this case, that was not the case. This is a sort of a medium-sized town with the main usage of water just being residential domestic consumption. And it also wasn't the case that people were sort of intentionally setting out to waste water. They didn't care about this. They did know about the issue, but they just had no idea how bad it was, what their contribution to it was, and what they could do about it. And so we came up with a few interventions that we wanted to test, which draw on behavioral science principles. So remember, I had when we talked about, various things that we think might not matter that do matter in affecting what we do. Well, one example is, what are other people doing, right? And that's often a very powerful motivator of change or of behavior change. And so in this case, one of the things we did is we had these stickers that actually just went on the water bill, and they were based on the consumption in the previous billing cycle. And they simply compared people to their neighbors. So in one version to the immediate neighborhood, and one version to the entire city. And it basically, used the sort of, even if you don't read Spanish, you can figure out that the blue one has this sort of, smiling water drop, and the yellow one has this sort of sad, crying water drop. And basically, the blue one is going to anyone whose consumption was below the average for the comparison group that we were relating it to, and the yellow one is going to anybody who's above the average, and basically has a bunch of information there about actions that they can actually take, things that have been shown to be feasible that actually do lead to a significant reduction in water use. And then we tested another intervention where we basically did a similar thing, where we had people sort of work out the comparison themselves. They got this sort of little postcard that filled in, it told them what the average was, and then they looked at their bill to see how much water they had used, and then that would either be above or below, and then they would sort of take, they would select or commit to a few of these steps to reduce consumption. Again, these are all examples of kinds of behavioral interventions that draw on a lot of literature, a lot of research. So just a social comparison, we know there's a lot of evidence on this. There's a lot of evidence that simply making you think about what specific concrete steps you would take, and then making you perhaps commit to taking some of them, is very powerful. And this has been used, for example, very, very effectively in the United States to increase voter turnout during elections. So rather than parties just saying, hey, we want you to vote for us, and this is when the election is, they actually will send out, nowadays often on SMS or on email, or even physical mailers, which will say, make a plan for how you're going to get to the polls on voting day. When will you go? How will you go? Who will you go with? And you will put this up on your fridge so that it serves as also a constant reminder. And those have been found to be very powerful. Now here, what we found was indeed that there was about a 6% and pretty consistent and persistent over about 5-6 months, for which we measured consumption after this experiment. And by the way, I should mention, for any of you who are interested in that sort of thing, this was a randomized controlled trial. So those interventions I showed you were sent to random subsets of Belén's population. The entire population was in the experiment, all the households. And so, there were 3 arms, 3 different interventions. A quarter of the people got one of the kinds of interventions, and then the final quarter were the control group. And we find this, this is relative to what happened in the control group. We find a persistent reduction in water use by 6%, which added up across Belén was a pretty substantial it's a small cities, but it was a fairly substantial dent on their water consumption. And according to some calculations that the mayor of Belen shared with us later, this pushed back their timeline for digging, essentially going deeper for water, for groundwater in Belen by several years, if this were to persist in the medium term. Okay, so very quickly moving on to another resource conservation example. And I only want to share this primarily because this also shows you that, this is not just about, individual decisions where, often we get asked, not all decisions are sort of individual. So some things happen in group settings, some things, it's not clear who's a decision maker. So if we think about an office building and the use of power, that feels a bit like that, right? Like in my house, I get the bill, I am responsible, or some members of the family are responsible, so we can at least sort of figure out what's going on. What happens in an office building? What specifically happens in a very, very large multi-story office building? And that's kind of the question that we wanted to address, primarily because, as I mentioned, in a lot of settings, you could do interventions on individuals, but you might realize that actually the bulk of the problem is coming from individuals in, let's say, a residential or a private setting. So if I think about power consumption, what I can see is that this is for Cape Town as a whole, or actually for, I think this was South Africa as a whole, that only 34% of energy consumption is residential. So if you're going to tackle power use, you're going to have to think not just about residential use, where behavioral interventions have been already proven to be quite impactful. You'll also have to look at non-residential settings. Okay, so this we've already talked about, the fact that not everything carries over directly. There isn't sort of these kind of direct feedback loops, for instance, in the case of power use. And what we found is that in a setting, and this was actually the Western Cape government's largest office building. So it's about 21 floors. I've forgotten the exact number, might be 22. It's one of the largest office buildings in Cape Town. The government notoriously was aware of the fact that it used way more power than the average, even for the commercial sector. But as you can see on the slide, there's a lot of things standing in the way of anybody actually getting to grips with this. So employees simply don't get any feedback, right? They don't know how their power consumption compares to what the norms are. They're not seeing a bill. They're not charged for it, right? This is the government that's paying. Obviously, you could say they're paying for it through their taxes, as everyone else is, but the point is that they don't directly see any responsibility. And it's certainly not clear within an office building whose job it is to take on some of these things. And frankly, it's not even clear to people that anything they do individually can make a substantive impact. So what we ended up with was an experiment again, where we divided the floors up into different groups, and we sent different versions of emails to various groups. And the one that proved most powerful was one where we, first of all, used floor level meters to generate these comparisons of how a particular floor, so this was floor wise, so we're essentially doing a floor wise competition, if you will, within this building compared to other floors, right? So how had their power consumption changed? How was that compared to others? And then we also added on a randomly selected person who worked on the floor to be the energy champion for that week. So basically you'd get this email which would say, this is how your floor performed relative to all the other floors in 6 Dorp Street, I think was the address, over the past week. And this is, this person chosen at random, a mayor chosen not at random, is eGov's energy champion for this week. What that basically means is, what we're trying to do is we're trying to get away from this idea that it's nobody's responsibility, but we're also not saying that it is one specific person's responsibility all the time. Why should it be, right? We're basically saying, hey, this week it's this person. So if you see him or her come up to you and say, would you mind turning your lights off when you leave? Don't think they're just being an annoying busybody. They're doing it for everyone's good because they've kind of been charged with this for this week. And obviously then you also want to give people some tips about how they can, how they can contribute to this. So I'll tell you actually something funny which might resonate with an Indian audience about what one of the major contributors were. But we were using some of these principles, and what you see is pretty strong reductions in energy, in electricity use. So 14% reduction, which is really quite large if you think about it, in the treatment floors versus the control floors. And actually, it fell by even more during non-working hours. So if you think about it, this is an office building, right? So it's not really occupied at all hours of day or night. But in fact, we had this picture taken on a Saturday evening when definitely nobody was at work at 4 Drop Street except maybe some maintenance people with sort of all the lights blazing. Unfortunately, we're never allowed to use that picture in any presentations because the premier of the province got very upset and was worried that people would see this and think even worse things about the government than they already did. But what you see is, as you would expect, and this sort of confirms in our experiment that the effect isn't just some arbitrary thing, it's actually happening from things that people are taking. Big drop during non-working hours. And the thing I was going to tell you is that one of the major contributors turned out to be that each floor at both ends had these little kitchens that people could use. And they have these things that actually I was working with some people who were, Americans, who were very puzzled by the existence of this object, and they couldn't figure out what it was. It was called a geyser, which nobody in the US had ever heard of, but I immediately knew what it was. And people were basically leaving the geyser on all the time. So geyser was running 24 hours, 7 days a week, even when, and really its only use in that setting is to, create hot water to do some dishes or clean something out, or perhaps if you're not fussy about how hot your tea is, you could make some tea with it, right? So that was clearly not meant to be happening. And what we think is that some of these kinds of obvious things people realized and then they were able to deal with. And I want to talk about one more project quickly, just because it's sort of a fun one and also relates to something that is a big issue everywhere. So this is to do with road safety. Now, the roads of South Africa are actually pretty deadly in per capita terms. I mean, we think India is bad and India is pretty bad, but boy, South Africa is even worse. And we wanted to remove the frame from sort of saying everything that was being done was infrastructure, was thinking about how do we make the roads actually physically better. And instead, we wanted to move the frame to saying, okay, how can we actually understand what's driving this sort of risky behavior? And in addition, we were approached, this was part of the series of projects with the Western Cape government that I just talked about, the electricity one. They said every year we have this spike in January. December, January, from mid-December to mid-January is peak summer, peak holiday season, festive season, all things put together in South Africa. It just leads to a lot of risky behavior, a lot of drinking and driving, huge spike in road deaths. And they were trying, they would put up more, road stops, they were doing a lot more enforcement. They weren't having a lot of impact. And what we then found was that one of the reasons that there was this sort of excessive risk-taking was that people generally don't think that people are basically overconfident, right? So they drastically underestimate the probability of being in an accident. They also think that they themselves are much sort of safer drivers than they actually are. And so we decided to sort of flip this on its head and say, okay, since people are really overconfident in their abilities, they're probably also overconfident about their ability to, for example, win a lottery, which, as we know, very low odds of actually winning. And so we entered people into a lottery that gave them the opportunity to win a 25,000 Rand. There were 2 prizes, but it would be, you'd basically forfeit your entry ticket, which was automatic, into the lottery if you got any kind of driving violation over this period. And so we were using a bunch of behavioral principles. And what you can see is we had a pretty dramatic impact. Just looking at what happened at that year in the pre and post period of the lottery compared with previous year. And so you actually see a significant fall in the number of deaths per day. And that's a pretty striking finding. Now, we started to talk about this when Amir was introducing me. This is the last set of things I'll talk about, is about using behavioral science in government responsiveness settings. And so we're really talking about, look at this picture. This is a tree that has fallen. We're sort of thinking about, systems that are set up to respond to things like this. And so what we know is that civic tech platforms can be very useful here because they provide a way for citizens to communicate with the government, for the government to know what the issues are. But we also know that getting citizens to engagement is not going to be sufficient because it also requires a response on the part of the government, right? And if you look at the way any of these platforms work, there is obviously a workflow that has to go through from beginning to end. And when that happens, there are a number of things that people have to do once a request or a complaint is received in order for it to be resolved closed, communicated, etc. So that's just a lot of ways that things can go wrong. And so in our work, we're looking at a number of different dimensions of this, and we're basically looking at, how, are these things resolved in a timely way, accurately, in a way that does not jeopardize equity, and are constituents satisfied with what's happening. So we wanted to do projects that would look at some of these aspects, and we are doing these 3 projects in 3 different countries, one of which, of course, is the project with eGov and the government of Andhra Pradesh at the municipal level in Andhra. And the others are in South Africa and in Brazil. And what you see is across the board, when you look at these different platforms, there are these sort of common problems. There are issues around intake. So you can see that sometimes things are not categorized or tagged or captured properly. There's a lot of issues around timeliness in terms of there are many parts of this chain. So both in Andhra and in one of our partnerships in Brazil, we see the same issue. Things are not moved forward in a timely manner, and things are not necessarily communicated correctly. These are just some examples of the kinds of things that can go wrong. And what we also find is a number of barriers that are sort of cross-cutting. So one is that there are a lot of hassles, right? So there's a lot of things that an official who's dealing with these systems might have to do, partly because there are a lot of fields and there are a lot of things that have to go on. So we have to then think about how do we retain all of this without necessarily overburdening people cognitively? And generally speaking, people are very busy. So they're juggling a bunch of different things. They have different responsibility. There's time pressure. And so here again, here's an example that, officials sometimes are so busy with what they're doing, and those might be other things, that they simply don't notice requests that have been piling up or that have been sitting in their inbox for a long time. So this leads to a reduction in timeliness. And similarly, of course, attention is limited. And so, you're again going to see that because you can't pay your full attention to the task at hand, actually things can kind of go wrong in the process where you're interacting, for example, with a constituent who is filing something or is making a complaint, let's say. And so we've done this sort of work of sort of trying to understand what the barriers are in the countries we're working in and with the partners. And then we're moving on now to design and testing. And obviously I don't have time to talk about all of them. So I'm actually going to talk about the work that we're all doing together with eGov and the government of AP. So this is a mock-up of the SMS notices that are actually just going out as of last week. They are going out to a subset of officials. And what we're basically doing is we're trying to draw their attention to the fact that some requests have been pending in their inbox for more than the number of days that they're supposed to. Not necessarily yet cross SLA, but cross let's think of it as a sort of a sub SLA, the amount of time that an individual at a particular level, because if each individual takes too long to, let's say, deal with something, even if it's sometimes just routine, they have to just forward it on to the next level up because there's no action that they can take. That increases the time that the request is sort of pending and leads to issues. And then eventually what we want to try and test is some changes to the actual inbox that they see on their dashboard. Add some filters so to show that which requests have been sitting for too longer, highlight the ones that are complicated, that may have been rejected by a senior officer, that might require some, add a pop-up that sort of summarize what's going on. So this is a sort of preview of the second design that we want to try out with the AP municipalities. And basically our current stage in most of these projects is, all the previous ones, that past projects have talked about what the results were, what we saw, what was tested. This is what we are trying to do now in all of these. So we're going to pilot test in Guntur. We're going to expand to 4 other large municipalities. And then we're going to be measuring these through experimental or quasi-experimental evaluations. Specifically, what we're doing in Guntur is we're doing, if there are any econometrics nerds among you, you will recognize the term of a stepped wedge design. But even if you don't recognize it, you can see why it's called that. It's basically a design where instead of having just a treatment group and a control group who sort of stay treatment and control throughout, you start out with most people in control and a small, let's say a fifth or something in treatment, and then you add another fifth and another fifth and another fifth and another fifth. These are all randomly chosen groups over time. So that by the end, everyone's getting the intervention and you're basically able to measure outcomes with more accuracy. And so I'll end here. This is thinking about what this could actually eventually end up with is a sample performance report that allows municipalities then to sort of, these are sort of wards, and looking at the ward secretaries to compare their performance with others and to be able to sort of benchmark themselves. So you'll see already flavors of some of the past interventions that we've talked about. So I'm going to stop there, and I would love to take any questions. And hopefully, Ameya, I didn't do too badly on time. Oh, we did very well on time.
You've done you've done so well on time that I'm actually going to invite you to tell us a bit more about the other 2 countries in this project.
Sure.
And what's happening there as well.
Yeah. I don't have, unfortunately, slides that I can tell you about, that I can show you, but I can tell you a bit more. In many ways, there's sort of, let me go back actually to where we summarize some of the problems that are going on. And so we're trying to address all of these challenges, right? So in Cape Town, one of the main things that's going on is that there's a lot of errors that are being made. And so we are testing a bunch of changes to the interface that actually highlight the fact that what operators are often doing is they're not filling in the geolocation stuff accurately because they think they can just figure it out later, or they sort of know enough about the place that it's supposed to be happening in. And so you end up with these unusable requests. So now these are sort of prompts to make sure that they actually ask the person who's calling. So these are call center operators. They're asking them for some of these details, and we're going to be testing that as well, although we are not as far along with that as we are with this work. And in the Brazil work, it's a bunch of different interventions. There are actually 2 partners. So there's an organization called Collab, which runs, which similar in spirit to eGov, but on a smaller scale, runs its platform across a number of different cities. And there, one of the main things we're looking at is the sort of final point of communication between the citizen and the government. So one issue we see over and over again is even when let's say a problem is either resolved or it turns out that it can't be resolved and there's something else, there's no communication with the citizen, which both leaves the citizen feeling dissatisfied and also increases the burden on the operations, because the same person may then keep calling up and filing further complaints, which further pile up in the inbox and so on. So that's again, we are testing some interventions that are on the platform, similar to the inbox changes that I mentioned. But also there's some work going on with the city of Sao Paulo, which is actually in an earlier stage. I think there we are still figuring out exactly what the designs are going to be, because they were hit very hard by COVID over the last year. I mean, it's still pretty bad, but we have not been able to move forward with them as much. But the hope there again, I think what you'll find is overall in all of these, the interventions are not, they're going to the exact way in which they're operationalized is going to be different, but they are quite similar in spirit, because, and that was actually our hypothesis going in, because we saw these common barriers and common kinds of problems. I think it was really quite striking. If I go back to the slide about some of these issues, we saw very similar problems happening in each of the settings we were working in. And that was actually the motivation for trying to look at this user behavioral science for these kinds of problems, because the intuition or the hunch, and it wasn't just a hunch, it was based on some initial fieldwork that was done just as a kind of exploratory exercise with a much larger number of cities and platforms, was that there are these common kinds of issues that arise with the use of any platform to solve these problems, which have really not to do with the deficiencies in the platform, if you will. They have to do with the way people interact with these platforms and whatever's off platform. And so, there's also issues about when and how people can and should engage with the platform. So one of the things we also see, for instance, and we're not necessarily going to be able to address this, is that people may not be able to actually access the platform at the time they need to. So if you think about an officer who's out surveying buildings, you might have to wait until he or she gets back to the office in order to actually fill in some information, and that could also lead to errors happening. So some of these things are a bit trickier to do than others, but that's the overall flavor of it. And actually, since we have a few minutes, another area that I think I haven't talked about, but that I think is very, very important is, and where behavioral science is making a lot of impact, is just in sort of the basics of things like revenue collection in urban settings. I mean, this is a huge problem everywhere, right? Like, urban jurisdictions typically rely mostly on some kind of locally generated revenues. That could be house tax, building tax, various levies and fees that have to do with construction and permitting and so on. These are their main source of income, but particularly when it comes to things like property tax, collection rates can be quite low. Even when properties have been assessed, people aren't necessarily paying up. They may be paying up late or not at all. And we recently, last year, completed a project with the city of Pristina in Kosovo, looking exactly at this, where we redesigned some of the materials that went out with the tax bill to incorporate a number of behavioral interventions. And we saw a pretty substantial increase. I can't remember the exact percentage change right now, but a pretty substantial increase in people both paying up at all, paying on time, as well as the fraction of outstanding dues that they paid. And so again, this sort of, all of this in some ways goes back to this idea that there's often this gap between intention and action, right? So not everybody who's not paying their taxes has kind of made up their minds to be a defaulter. Some of them are just not getting around to it, or some of them think it's not actually that important compared to other things they have to deal with, or it's something that they've just put off, or they think, it doesn't really matter. And so if you can address some of these things in the way that you communicate, in the way that you actually, send these demands, for instance, send these notices, you can have a pretty large impact on what happens. So anyway, let me stop there.
Great, thanks so much. And I think definitely there will be people at eGov who will be interested in reading more on this last case you spoke about as well, right, on Pristina. And I think we can share separately to grab that.
Absolutely. We can share, I think, at least a draft report and some slides on exactly what was done. And interestingly, we did have, I would say, fairly promising, but eventually eventually killed by COVID, if you will, discussions with one of the municipal corporations in Delhi about trying something similar. This was the North Delhi Municipal Corporation, and the commissioner was quite interested in trying something like this because they do send out notices, and their collection rates are absolutely abysmal, including from a lot of commercial properties. They don't get any property tax at all. And so I do think there's a lot of scope to apply this in the Indian context.
Super. With that, let me open the floor to questions where about 30 people. So I think if people, we can do raise hands. You have one question in chat already, Saugato, if you want to.
Yeah, I can look at the chat actually.
So one from Smita and then one from Manish.
Sure, let me take those in turn. So our changes is a very good question, and a question that I think we often face and often get, and to which unfortunately I don't have a very good answer. Are the changes, so what Smita asked is, are changes brought about by such behavioral interventions temporary or permanent? Short answer, we don't know, and it depends, which is not very helpful. But let me give you some examples of why we don't know and why it depends. So I think the critical factor is when you change a certain kind of behavior, does that in some ways fundamentally align with what people are actually trying to do? Like they're not actually trying to not do that behavior, it's just that they're not doing it. Then that change has a much larger chance of sticking. So you look at these intention action gaps, those have a larger chance of sticking because it's not like I set out to waste water, right? I'm wasting water in a variety of ways without really thinking about it. So once you make me sort of change my behavior in that regard, it can easily become a habit. And I think there's a lot of literature on kind of habit formation. It's not always like, I don't always buy the sorts of findings which are like, if you do things this many times over this period of time, it's going to become a habit. But I don't think you can be that precise. But there are ways to sort of encourage habit formation. And you can think about, I think anything behavioral, if you're thinking about these kinds of interventions right now, think about yourself and think about any changes you've had to make because of the pandemic. And think about which of those changes you might actually persist with even once the pandemic is over and things are back to normal. But which of those are things that you might actually give up. I will say that where we've been able, like for example, the water example that I gave you, there we found we were not able to continue measure. We didn't get data eventually beyond about a 6-month point, but at least after then, after the one-time intervention, there were persistent results. They did attenuate a bit towards the end, so it's not like it was X% to begin with, it became a little less than X, but it was still significant. It was still positive. And there's this company called Oak Power, which I think also has doing some work in India now, where they've done these kind of behavioral informed interventions for energy use in residential settings. Now they do a repeated things. You get it with each bill and it sort of changes a bit each time, but they're found very long lasting impacts. On the other hand, there are definitely cases where you could get an impact for a short period of time, but then people essentially revert to what they were doing beforehand. So I don't think there's a clear-cut answer overall. The next question has to do with adoption of a digital platform converting non-users to users. So I can't give you a comprehensive overview, but certainly we have done a bunch of work around that. And actually Preeti, who's on this call, I think from ideas42, worked on a bunch of these projects. She's our projects director in India, heads our India operations. We've done this mostly in the context of digital mobile or digital financial tools. So, banking apps and things like that. And there are definitely ways, what we find is that there are definitely ways to spur initial engagement or to expand the ways in which people are actually using a particular platform. And this may be relevant even to, for instance, the way that citizens use eGov's platform. Often what we find is that people come to something with a very specific use case in mind, and they never end up looking at the other use cases, which might be for things that they do need and that they are doing. So so yeah, there's definitely, I think most of that work is in the financial inclusion space. I can share with Amir, and he can share with the rest of the team a report on some of the work we did about driving user engagement. I will say that when you start measuring things experimentally, you rapidly find that baselines are really, really, really low in a lot of these cases. Like even a very, you could have an app that a financial product that has been downloaded, you'll see really high sort of sign-up rates. That is sometimes driven by the fact that people are essentially defaulted into these when they're using other, let's say, banking services, right? But then you look at how often anyone even opens it or does anything at all with it, and it shrinks to a vanishingly small fraction. And so there's a lot of work to be done, but I'm just saying this because, you're not going to get, really high rates of usage immediately. You're going to go from really, really, really low to really, really low, and then hopefully to really low, and so on. Smith, I have another question, which is to do with corruption or rent seeking with such interventions. There hasn't been enough work done, I think, on this, but there are reasons to think that some aspects, rent seeking may be harder. I mean, I think like as a sort of that's a very complex issue. And corruption, of course, is also a very complex issue. And there are a number of sort of incentives on various sides. I mean, it has to do with what's driving it, but to the extent that some of it is driven by the normalization of corrupt practices or of taking certain kinds of bribes, or the invisibility of certain bribe taking or other corrupt behaviors. I think there is an interesting, there's sort of a nascent body of work in behavioral science which sort of does things like trying to make things more public or trying to highlight instances, for instance, where people have gone against the grain, which I think merit broader testing. I don't know that they've been tested very carefully yet. But again, I think, often there might be quite an interest, for instance, even when we're talking to the North Delhi Municipal Corporation, one of the things they wanted to do was to find a way for people to actually complain about if they had been harassed by a tax, what do they call them, like assessor or something like that, right? Like, but how do you set it up in a way that there's no retribution people are, and so I think there are ways to try, and I don't think you can get rid of these behaviors, but you can try to reduce their incidence over time.
I think one from
Any more
Samya.
questions?
Yes.
Oh yeah, okay, yeah, I see it now. So Soumya is asking, are governments able to implement the interventions recommended through your programs easily? Do constraints of capacity or political will play a role in the acceptance pace of implementation? Absolutely, those are major constraints. So one of the key challenges when actually designing for any partner, not just governments, even large NGOs, capacity is a huge issue, right? So if you do anything which is going to require a lot of time and effort, it's harder for it to be taken up. I think we've even seen that with the case of our partnership with eGov and the government of AP. The SMS intervention took a lot longer to happen, partly because eGov is not directly involved with the government in the way that it was before. The government, hired coders to try and do this. And in the end, I think we had to sort of rely on eGov's good offices to try and push this forward, because there simply wasn't that kind of capacity within the government to this was not a terribly complex task, but it did need to be done with some degree of attention and accuracy and in a timely fashion. I think you also asked, are they able to implement the interventions recommended easily? Again, it depends on the intervention. I think we try to make them as user-friendly from the kind of implementer point of view as possible. But certainly that should be the goal, because again, we know that capacity is always going to be an issue. So if we come up with something that is really capacity intensive or time intensive, it's, in some sense it defeats the purpose. And actually some of the work we're doing is actually about trying to take things that would have to be done by, let's say, a government official and translating it into something which doesn't require them to do an awful lot. So instead of them having to do a lot of, let's say, training with beneficiaries when it comes to, let's say, a cash transfer program, can we actually create tools that allow beneficiaries to do some of this on their own? And then their job is limited to sort of handing this thing out and, sort of giving people time to do it. I think those have a better chance of working. Vidya has asked a question about designing incentive programs to drive behavioral change. So I would think of, now I don't know whether you mean specifically monetary incentives. I think that's often what people mean when they say incentives, but of course incentives can be both monetary and non-monetary. It's actually a very large literature about the fact that non-monetary incentives can be extremely powerful. So I would urge anyone who's interested in this to look at, for example, the work of Nava Ashraf, who's now at the London School of Economics. She's done a lot of work with things like healthcare workers, where you think that, obviously it matters how much they're paid, and people often will try to, let's say, incentivize them on particular numbers of routines done. But she finds that actually appealing to their inner motivation or giving them a clear career path, these are often much larger incentives, if you will, than the small amounts of money you're going to be able to give them as a real incentive. On the other hand, you can think about something like the lottery example as an example of a monetary incentive. But again, there's a twist there, because it's not just saying, let's give everyone a little bit of money, actually only giving two people fairly large sum of money, but you're making everyone think that they could be those two people. And that's what the powerful thing is there. So in the US, for example, a number of states are starting to use lotteries for getting laggards to come and get vaccinated, since the US is in the unique position of sitting on a stockpile of vaccines that they're unable to get to people because people no longer want them. I mean, the people who are left, like 60% have got them, and everybody else is sitting on the fence. And so they're trying to see if these kinds of incentives work. Now, what I will say is, this is why it's so important to be careful about who we're targeting an intervention to and what intervention we're using. If the people in the US who have not received the COVID vaccines at this point are dead set against it because of a number of things they believe about the vaccine, giving them the chance to win a lottery is not going to do very much. It's if there is, and there is reason to believe that there actually is a significant chunk of people who haven't got the vaccine, not because they hate the idea or they're sort of anti-vax, it's because there are a number of other situational factors that have got in the way. They're not eager, but they're also not against it. And there, something like this might help. Smita has asked this interesting question about, I paid a bribe and I did not pay a bribe, like doing a campaign that does, and the other one. I would actually, I don't want to be too definitive about this. I haven't looked at this specifically in detail, but what I will say when I look at this is, I think this is exactly where behavioral science is important. these are playing on two different aspects of people's identity and the way that they think about it. I paid a bribe could have the counter sort of unintended consequence of normalizing corruption, right? So if I see a lot of people saying I paid a bribe, then I start to think that actually, why am I the only fool who did not? I should have just done it. Everyone's doing it. It's very normal. And saying that you did not pay it could actually help in an opposite way. So I think those are often this is exactly this question of how do we frame something, and then what is the impact of that particular framing. If you go back to our road safety lottery, one of the critical things we did there was to say, we are entering everyone into this lot. Everyone who has a driving license and is registered in the province is entered into this lottery by default. So you don't have to go and buy a lottery ticket. You have this lottery. The government has given you a lottery ticket. Now, if you are stupid enough to drive without your seatbelt and you get caught, you lose the lottery ticket, right? So you had this thing, you had your chance of winning 25,000 Rand, and you should just have put your seatbelt on, or you should just definitely not have been driving drunk or whatever else, or speeding or whatever else you were doing. And so it's sort of changing it from a gain frame to a loss frame. It's changing it from saying, could I win this, to saying I could actually win this. Oh, damn it, I can't win it anymore because of something I did, right? So that was the idea behind framing it that way.
So
I
we're
think
at
that's
6:25. We have about 5 minutes. I do want to ask, like the question I was holding back, but then you broached the topic of vaccine hesitancy in the US as well, right? So talk to us about behavioral science and COVID, vaccines, masks, etc. What's the landscape? Where do you think stuff can be done?
Yeah. I mean, I would urge, I was listening to a podcast recently, and I unfortunately don't remember the name of it, but it had an interview with Katie Milkman, who's an ideas42 affiliate. She is at the University of Pennsylvania, I think, now, and she's a behavioral scientist. And, they asked her this question about what do you think the role of behavioral science has been in responding to COVID? And her answer, which I agree with, was that the role of behavioral science has been not enough and not early enough, right? So if you think I think behavioral science has a lot to say about all of these issues. When we're trying to get people to do a certain thing, what's the right way to actually frame it to them? What are the right ways to address different categories of people, those who might be hesitant, those who might be firmly against it, those, and I think instead, typically public health messaging goes with sort of a, sledgehammer, like, or with rules and that, or with, and those are obviously relevant and important, but I think the role of behavioral science there is to help us think about, I mean, if you think of something like hand washing, which, in the end turns out wasn't like such a huge driver of COVID, and maybe we ought not all should have been obsessively, sanitizing and washing our hands. Probably not a bad thing in general. There's a lot of behavioral science work on how do you create these habits of regular hand washing. And I think some things that were quite behavioral in spirit were the idea of giving people a sort of heuristic for what was 30 seconds of hand washing time. I think the most common one was saying happy birthday twice. Although I always thought it really depends on happy birthday to whom. If you have a really long name, it's going to end up with more than 30 seconds. But you know what I mean? Like, that was something most people could get. There's an equivalent to this song probably in every country in the world. And you could say, rather than, you can tell people 30. So it's like sort of like saying, tell people to save water, but they don't know how much water they consume. They don't know how much they can save. They don't know any of this, right? So I can tell you to save water, and you're just like, yeah, but I don't waste water. I use water for things that I need. You want me to not drink water? Obviously not, right? So with the hand washing thing, I think with masks, one area where I saw there wasn't enough reliance on kind of giving people clear heuristics was about when to wear and when not to wear a mask, right? So I think most places went with this kind of blanket, wear it or you're in trouble, or suddenly saying you don't have to wear it anymore, right? Whereas I think really, as we learned more about the pandemic, certainly it felt like there's actually a set of rules of thumb that you should use. Who am I around? Is it a closed setting? Is it an open setting? Are there people around me? That should determine whether my mask is on or off, right? And so the problem with a blanket thing becomes that if I tell you have to wear a mask all the time, you're not going to do it, right? You're going to find any opportunity because it's uncomfortable beyond a point. It's hot, it's cold, whatever, right? So you're going to take it off. And so by setting the bar at, if you're not doing it all the time, you're failing. I'm basically encouraging you to fail even more than you would otherwise have done, right? If I had instead said, always carry one and wear it whenever you're, in these very simple situations, I think that would have been, I mean, I've lost count of the number of times, this is in the US, you've certainly seen this in India also, where, people are wearing a mask on the street. As soon as they come into your house, they take it off. And that's the exact opposite of what we should be telling people to do. Like, don't wear it on the street, it's fine. I mean, maybe if you're obviously in a crowded place, it's, ideally don't be in a crowded place, but wear it indoors, right? Indoors is where you need to be when you're in close proximity with other people, you're sitting with them for a while, you're talking. That's when you need to be wearing it. That's exactly when people would not wear it, right? So I think there were a lot of underutilized lessons from behavioral science. Obviously, I understand why that's the case. I mean, it's a pandemic, it's fast moving, you don't know very much about it, but I think we could have used it more. You are starting to see some of it being used in the vaccine case. I think when they've been thinking in countries where there is decent vaccine availability and the real issue has become hesitancy, or or people who don't want to get it for a variety of reasons, they have been thinking more carefully about segmenting the population and then thinking about what kind of messages would in fact resonate. And there is a lot that that behavioral science has to say there. So I mean, that we could talk about this all day, because I think, as I said before, like anything I think about now, I sort of immediately, if I'm trying to understand how a person might behave in a particular situation under a particular set of constraints, I'm like, what would I do if this was to do with a mask? Would I immediately come to the so-called right conclusion, or would I sort of veer off in all kinds of weird directions? And when you think about these things carefully, you realize that certain things are counterintuitive. So I'll give you one example, by the way, is in the beginning in the US, they were really insistent that everybody had to, you had to wear gloves when you, let's say, went into a shop in some places. And it seemed like a good idea to me. It was like, okay, let's wear a glove. We realized once you're wearing gloves, you become less careful about what you're touching and what you're doing with it. In your head, you're protected, right? And so now your glove is touching various things, and then you're touching your face with your gloved hand, which is probably exactly the thing you don't want to be doing. If your hands are free, you are actually more aware of the fact that it's my hand and I should not be, touching random objects and putting it back to my face. Although, as I said, now we know maybe that was fine all along, but that's the kind of thing. So I know we're at time, and so I'll stop there.
Great. Thank you for a really fascinating session. Let me see, maybe I can loop in. Is Jojo on the call?
Yes, I am.
Great. Can I loop you in for like 2 minutes of closing and thanks?
Cool. Yeah, so this is super interesting, and I have been in touch with Preeti, and we've gone over the stuff that's going on in Andhra Pradesh. Fascinating, and I think we're waiting for the results to come in from there and see whether this can be really scaled up into everything else that we are doing, right? So that's great. So I love the closing, and I'm glad that you kind of brought in the whole aspect of COVID, right? And because you've seen very, very different results on. I remember there was very, very early on when the pandemic started, I think I came across a tweet by Mr. Taleb, where he had basically drawn out this entire kind of graph showing countries that wear masks and the countries that don't wear masks, and the entire result. And this is before. This was really before, when it was clear on how the transmission actually happens, right? And that was just looking at the behavior of people in determining which way the pandemic is going, how does it spread, etc. Saying even without any other evidence, you can just look at behavior and look at that as a pointer. So I'm glad that you brought that in, Amya. That was that was super interesting, and we obviously know a lot more now. But coming to some of the questions that were asked during in the chat, these are important things for us to think about on how do we increase, say, adoption, right? And I think we've had a chat with Preeti and team on the work that we're doing in Punjab, whether there's, what do we need to start looking at? What do we need to start capturing in terms of data? Of course, the time for that one was very short, but we do look forward to engaging with ideas42 on a lot of these things, right? And I think it cuts across everything that we're doing, really. So thanks a lot, Mr. Pato. I think it was fascinating being part of this, and we look forward to getting you on board over here for more such talks. And I think it's really useful to get these perspectives from across the globe as well.
Thank you. Thanks for the opportunity. It was fun talking to all of you. And of course, I'm in touch with several of you. So we'll continue to think about ways in which we can keep working together. It's been fun.
We're going to reach out to you on sanitation for sure, right? And I spoke to Preeti about that. We are going to reach out to you on that. So look